All right, we'll get started. Thanks everyone for joining us. I'm Ryan Spiteri, the Communications Manager here at the Brant County Health Unit. Here with me, I have Dr. Rebecca Comley, Acting Medical Officer of Health at BCHU, and Dr. Joanne Tober, BCHU CEO. Before we get started, can we do a quick roll call for those joining us? I'll just have you state your name and your affiliation.
Patty Berardi, Rogers TV. Michelle Ruby from the Expositor.
Thank you. In a moment, I'll turn it over to Dr. Comley to make a brief statement. This will be followed by a question and answer period where questions regarding COVID-19 case trends, case and contact management, etc., can be directed at Dr. Comley, and questions regarding vaccines can be directed at Joanne. At this point, if you could put your phone on mute if you're able to, we'd appreciate it, and I'll now turn it over to Dr. Comley.
Thank you for joining us, Patty and Michelle. I'd like to start by passing on my condolences to the loved ones of the community members we lost recently to COVID-19. Last week, we saw a large spike in PCR-based positive cases. As we've mentioned previously, based on the province's updated testing strategy, reported case numbers are not a good metric when we can continue to use to distinguish the true level of infection in our community. With the level of transmissibility that we know Omicron presents, each setting now presents a much larger risk to acquire COVID-19 than we've seen previously. This is the mindset we need residents to consider when they are going about their daily lives. As data continues to come in, we are seeing largely the same patterns as other parts of the world with respect to Omicron. Infections are generally presenting as milder than previous waves. That said, we are also seeing the same healthcare capacity concerns as other areas as well, based on Omicron's advanced ability to spread. The province has announced new measures to help blunt transmission and prevent hospitals from becoming overwhelmed as booster dose continues to roll out. While we are in this pause, it is critical that we all do what we have not, if we have not yet done so, to receive first and second dose of vaccine. Data released by the Ontario Science Table continues to point to vaccines being effective at preventing hospitalization and ICU stays. The best thing we can do to protect our healthcare system is to receive a vaccine. The percentage of those who remain unvaccinated have the capacity to overwhelm the healthcare system based on what we know about Omicron. Appointments remain open for third doses for those eligible, and walk-ins are continuing for those who want to receive a first or second dose. I'd also like to address the pause on in-class learning for students beginning January 5th. As my predecessors and I have stated previously, in-class learning is an essential piece in a child's overall development. It is definitely disappointing for all who have in-class learning paused. With the COVID-19 situation currently unprecedented, there are not a lot of great options available. This will ring true with respect to all of the new measures announced yesterday. Our hope is that this pause will allow children to be vaccinated in order to protect against severe outcomes. Again, I'd ask parents or guardians to use this time away from in-class learning to protect their children with a first or second dose. Thank you.
Thank you, Dr. Comley. We'll now open things up for questions.
It's Michelle from the Expositor. I have a number of questions. Maybe I can start with vaccine appointments. I know that there were, I think, more than 6,000 appointments booked up until Wednesday. Have you opened up new appointments, and how are they being taken quickly as well? And are you increasing the number of vaccine clinics?
Yes, we're expanding our capacity at the clinics as much as we can. We're constantly adding new appointments to the system, and we're also going through and removing cancellations and people who have already received their doses. So there are new appointments coming up and new availability as well. Our pharmacy partners have working very hard, and they've been working to expand their capacity as well.
So what would you recommend that people do? Do they come to the website, check the website every day, or what's your recommendation?
Yes, I would recommend that they check the website regularly because new appointments are coming available on an ongoing basis.
I also wanted to ask about an outbreak at Fox Ridge Care Community and Long-Term Care Facility. According to the health unit stats today, there are 36 people with COVID, 25 residents, 11 staff. Is the health unit working with Fox Ridge, and what's happening there?
Yes, with any outbreak in a high-risk setting, we're actively involved in outbreak management, and we have been from the beginning with Fox Ridge as well. First and foremost, we work with the staff at the long-term care facility to make sure that they have the capacity to maintain outbreak standards and IPAC, which is the infection prevention and control standards, in place. We also discuss with them health human resource capacity and help to facilitate any supports should that be necessary. The other thing that we also do is help recommend testing going forward as well, and recommend ways to isolate cases if possible.
Sorry, so I would imagine that, and maybe you answered that already, but I would imagine that they're very short-staffed with 11 of them being ill or having COVID. Did you say that you somehow help them with their staffing issues?
What I meant to say is that we often will discuss that with them, or we have a conversation about it so that we can help troubleshoot, or we can help if we need to escalate, then that gets flagged, and that has not happened in the case of Fox Ridge.
Okay. There's also an outbreak at the John Noble home. Is that in the long-term care portion of the facility, or are there also cases in the independent apartments at John Noble?
I know of the outbreak. I do not know specifically what part of the facility that outbreak is in.
Okay. We've heard that W. Ross McDonald School has closed indefinitely. Does the health unit track cases there?
We do.
Yeah. And can you tell me how many cases there have been at the school?
If there's no cases posted, there aren't any. Sometimes there is a bit of a time lag based on the volume of cases we are getting in, but
right.
That would post.
Okay. The website indicates today that there are 19. This is the Brant Community Healthcare website indicates there are 19 people at Brantford General today with COVID. Do you know if they all went in with the virus, or were they there for other reasons and then tested positive for COVID?
We don't have that information. You may want to check to see if that data is available through the hospital. Okay.
Do you know when the community will be getting more rapid tests? Does the health unit? I don't know if the health unit distributes tests. I don't think you do, but
we don't. And certainly we, like many people, are trying to access rapid testing for our health human resource needs, but we do not have any special access to rapid tests.
Okay. Also, some confusion, I think, about the number of people, local residents, who have died in the last few days due to COVID. I've been told the provincial website had been showing 37 local deaths for Brant and Six Nations, and that went up to 41 today. Have there been 4 deaths over the last several days?
I can only confirm the deaths when we do get a confirmation through a death certificate here. So that's why there sometimes can be a little bit of a discrepancy with the statistics, but we wait until we get full confirmation before we report them.
Okay. That's all I have. Thank you.
Thanks.
It's Patty from Rogers. And following up on that question, do we have any information on the 2 recent deaths that were reported, I believe, on Friday?
Yeah. I can tell you that they were both men in their 70s, and they were both hospitalized at the time of death. And in terms of, there were suspected community transmission in both cases as well.
Okay. Now, there's quite a bit of frustration on some people's part, as you can imagine, with the new regulations. And a lot of people are questioning whether vaccinations are even working because they're still seeing cases. Can you just clarify the point of view of vaccinations and why it's important in terms of preventing serious illness?
Certainly we're seeing with Omicron, we're getting more breakthrough infections and we're getting more transmission even in vaccinated individuals, and that is definitely true. We're also seeing there's waning immunity over time after second dose with Omicron protection. So as time lags from your last dose, your chance of getting infected is high. So that being said, the vaccination is showing to provide some protection against severe illness and also ICU stay. So there is, again, still good evidence that it provides protection against severe illness. And the reason that the booster dose is so important is that time after your last dose does have an impact. And so that's why we're trying to be as proactive as we can in getting many people boosted to get that added protection from the third dose.
And do you think too, sorry.
No, go ahead.
A lot of people continued to act as if life was normal too, vaccinated or not. Are we still seeing a result? I know it's very hard to contact trace when you have almost 1,000 cases in a week, but is it by and large close contact with a confirmed case that you're seeing?
In the last couple of weeks, we have not been doing active contact tracing because of the capacity issue, for one, and the number of cases is virtually impossible to contact trace. So we're generally seeing more community spread. Obviously, household contacts are higher risk, but general community spread is widespread. So we're not looking at hot spots or outbreaks in the same way as we were before. We're seeing spread everywhere. It's widespread in our community as it is across the province.
Okay,
so
and just
less because it doesn't give us as much information at this point.
Right. And in terms of the breakthrough infections we're seeing in long-term care, are these mild infections or are they serious?
I think it's a little early to say right now. I think because we're just at the beginning of this and we're just seeing our first outbreaks, I think it's a bit premature to say one way or the other on the severity in long-term care. And we'll have to wait and see, get a bit more information before we make a comment.